For your health tonight, there's a new way leaders in education are trying to fight the opioid epidemic. A new state grant will help the University at Buffalo train physicians and nurses on how to medically treat people who are addicted to opioids. News 4's Marissa Perlman explains.
It's unlike any other drug epidemic that we've seen.
UB's Research Institute on Addiction is spearheading a training effort to fight the opioid crisis in Western New York and across the state. RIA Director Dr. Kenneth Leonard says there's an FDA-approved medication readily available on the market.
Buprenorphine is one of the medication-assisted treatments that is used for all three of those, for prescription opioids, heroin, and for fentanyl.
The drug helps alleviate the cravings people who are addicted to opioids feel. However, before it can be used, Dr. Leonard says doctors and nurses need to be properly trained to distribute it.
It has much more to do with sort of the interpersonal contacts and how to manage this in your office, and less to do, a little bit to do with the pharmacology of it, but it's not a very complicated drug.
The program will target 16 high-need counties and tribal areas across the state, some in highly rural areas, which has its own set of problems, bringing patients to the clinics.
One of the biggest issues in a lot of the areas is transportation, that there's not public transportation and their access to cars may be very limited.
But the drug is not a cure-all. Dr. Leonard says the drug gives people a bit of a clear space, but it needs to be accompanied by a comprehensive treatment program, too.
It has a little bit of the actions of an opiate. It goes to the same part of the brain and activates those same cells in the brain, but it doesn't make a person high. It doesn't make them non-functional.
The goal is to have these trained doctors vetted as trainers and then spread the knowledge on, something that would hopefully make an impact across the state.
This is not a matter of just willpower. You know, people can't overcome it just by deciding that they're going to overcome it.
Reporting in Buffalo, Marissa Perlman, News 4.